All right, welcome back in. We're focusing on your health today and the signs and symptoms of stroke. So this is a very important topic. Shelby Baptist Medical Center's Chief Medical Officer, Dr. Jade Brice, joining us now virtually. How you doing, Doc?
I'm well, and you?
I'm doing fantastic. So we're talking about stroke signs and symptoms, and I guess the first question is, how common are strokes in the United States?
Strokes are exceedingly common here. Stroke is the fifth leading cause of death in the U.S. and the #1 leading cause of disability in the United States.
Yeah, so what are the types of strokes? Because there are different ones.
Yes, the two main types are ischemic stroke, which is a blockage, or hemorrhagic stroke, which means bleeding in your brain.
Yeah, and how can you reduce the risk of having a stroke?
Some of the main ways: controlling high blood pressure if you have it, don't smoke or consume alcohol in excess, lowering your sodium, your cholesterol, losing weight if you're overweight, and getting physically active and staying physically active are all ways that you can lower your risk.
But are there some types of the characteristics of strokes that we can't control that could change the risk factor?
Yes. So as you age, that increases your risk. So age, you can't change your sex, you can't change your family history, you can't change things that have already happened, like if you've already had a stroke or a heart attack. So those are things that you can't change.
Okay, and then everybody needs to know, what are some of the warning signs that you could be having a stroke?
Yes, absolutely. Sudden onset of weakness or numbness, especially if it's on one side or the other. Sudden trouble speaking or confusion. Sudden changes in your vision. All of a sudden having trouble walking or issues with your balance. A really severe headache that comes on all of a sudden. Those are all things you should worry about.
Okay, so what do you do if you're starting to notice some of these symptoms that you're occurring? What do they have to do?
We want you to call 911 first of all, because that is the best way to get to us. Call 911 and get to the emergency department. When you call 911, it activates the system. We know you're coming, and so we can get everything ready for you because time is of the essence.
Okay, and there is an acronym there, Be Fast. What does that stand for, and what does it mean to people?
Be Fast stands for B is for balance, E is for eye, fast is face, A is arms, S is speech, and T is time.
I put you on the spot right there. Yeah, you handled that well right there.
Yes.
Excellent job. This is such a critical topic, and we certainly do appreciate you joining us today, Dr. Brice. So good luck to you, and we appreciate your help, okay?
All right, thank you.
All right, take care now.